The surge in respiratory illnesses across the country, flu and RSV cases are overwhelming so many hospitals and patients, so many of them very young. ABC's Elwyn Lopez joins us now from Atlanta. And Elwyn, we haven't seen flu activity this high, this early in years.
Yeah, Janae, that's right. We're seeing hospitals getting hit harder and earlier than usual. The last time we saw hospitalizations this high this early in the season was more than a decade ago. Now, take a look at this. More than half of the country, including New York City and D.C., are now reporting high or very high levels of influenza-like activity. The CDC estimates that there have been at least 4.4 million illnesses so far. That's about 1.5 times higher than the previous week. Now, this is all unfolding as we continue to see cases of children with respiratory illnesses soar. Nearly 80% of pediatric hospital beds are already full. And this week, the American Academy of Pediatrics and the Children's Hospital Association called on the Biden administration for help, filing a formal emergency declaration request amid the, quote, alarming surge of pediatric respiratory illnesses. And Janae, healthcare providers say that they're mostly seeing these flu-like symptoms in younger people. They say most of them are children under the age of 5.
Incredibly concerning. Elwyn, thank you. And let's bring in ABC News medical contributor Dr. Darian Sutton to talk more about this. Dr. Sutton, good morning to you. Thanksgiving just days away. How do we stay safe? Are flu shots enough? And should we rethink those holiday guest lists?
Well, good morning, Janae. Flu shots are one part of the way that we stay safe, and it's an important reminder, if you haven't done so already, to go out and get it. Every year, Janae, we do testing on genetic analysis on the most commonly circulating strains of the flu, and we compare that to the strains of the flu included in protection in the flu shot. And thankfully, this year, the most common and dominant strains are included in the current actively given flu shot. Also, make sure that if you're outside and you're in a crowded space, to wear a mask, to clean hot-touch surfaces. And one of the best ways to prepare for events is to prepare as if you are preparing for the highest risk person in the room. That includes the person who's over the age of 65 and or someone who is pregnant or someone who is an infant. You want to make sure, again, that you are preparing to keep those safe, specifically because they are at incredibly higher risk.
And Dr. Sutton, as we're also hearing so much about RSV, are we basically back for Thanksgiving to the COVID playbook, opening windows, wearing masks, social distancing?
Yep, absolutely. Basically, that helps to decrease transmission if you want to increase the amount of ventilation in the room. Also making sure that if any children are coming or anyone at that at all is coming and they have symptoms, that they stay at home, regardless of whether or not that rapid COVID test is positive. And then also making sure that your children are up to date on all of their vaccines. I've been looking at some numbers, and we've been seeing in Ohio cases of measles, unfortunately, and all of the cases that we've seen so far in these 18 documented cases are in children who are unvaccinated against measles. So if you haven't done so already, make sure that your child is up to date on their routine vaccinations.
Good reminders, Dr. Sutton. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.